This webinar is a part of the Direct Care Workforce Strategy Center National Webinar Series. Today's webinar is titled Workforce Investment Systems 101, Engaging with State Workforce Systems, Learning the Language to Build Partnerships. Before we begin, some important housekeeping items. All participants have cameras turned off and are muted. Participants may submit questions via the Q&A feature. If time allows, we will take questions at the end of today's session. We also have ASL translation and CART available. CART can be accessed within Zoom or using the link in the chat to open in a separate window. Spanish translation via CART is also available through the link. Please reach out to directcareworkforce@ncoa.org should you have any technical issues during the webinar. The webinar will be recorded, and a copy of the slides will be available after the webinar. My name is Laura Thorne, and I serve as a project manager of the Direct Care Workforce Strategy Center, housed at the National Council on Aging and run on behalf of the Administration for Community Living. I'm joined today by my National Council on Aging colleague, Stephanie Gibbs. Stephanie Gibbs serves as the role as Director, Direct Care Workforce Strategy Center at NCOA. She has a background in aging and disability policy, Medicaid and home and community-based services, and system-level healthcare transformations. She is a 2020-21 Robert Wood Johnson Foundation Health Policy Fellow. Previously, she served as the Director of System Transformation for the State of Tennessee TennCare Division of Long-Term Services and Supports. In this role, she led efforts to align Medicaid policies and programs with person-centered thinking and practices, advance social determinants of health efforts, and promote improved quality of life and employment and engagement opportunities for older adults and people with disabilities. Gibbs served as Senior Program Officer with the Center for Healthcare Strategies and is the National Director of Advocacy with United Healthcare Community Programs. She began her healthcare career in direct care, working as a certified nursing assistant supporting older adults and people with disabilities. Today, Stephanie and I are joined by our colleague from Department of Labor, Jen Smith, Division Chief for the Division of Strategic Investments in the Department of Labor, Employment and Training Administration's Office of Workforce Investment, OWI. In this position, she provides leadership in developing programs and policy guidance for ETA's discretionary investments in skills training and employment programs. This division administers the Strengthening Community Colleges training grants, as well as a portfolio of initiatives funded by the H-1B Skills Training Grant Funds. Prior to joining the division, she provided leadership in developing policy guidance and technical assistance for youth workforce development as the program manager for the department's Youth Build program. In 2014, she was selected for a President's Management Council rotation, where she detailed at the Office of Management and Budget in the Labor Branch. While there, she worked on budget and policy issues related to the implementation of the Workforce Innovation and Opportunity Act. She has also served on a detail to the Senior Community Service Employment Program, supporting low-income senior citizens with job assistance. She has 20 years of diverse workforce development experience, including for priority populations, focusing on in-demand industries and growing opportunities for apprenticeship. We are also joined by association colleagues Ben and Brad. Ben Mays, Policy Director, National Association of the State Workforce Agencies. Ben Mays is a policy director at NASWA, a national organization representing workforce agencies in all 50 states, the District of Columbia, and U.S. territories. Prior to joining NASWA, Ben Mays served as a policy advisor within the state of Rhode Island's Executive Office of Commerce, where he advised the state's first ever Commerce Secretary. Prior to his time in Rhode Island, Ben held several roles in the public, private, and nonprofit sectors, including as a Dukakis Fellow in the Office of Nevada Governor Brian Sandoval. Brian Turner-Little is CEO and President of the National Association of Workforce Boards. Turner-Little brings to NAWB a wealth of experience and knowledge about workforce development and national membership networks, as well as a strong desire to advance policy that enables local workforce development boards to serve their communities even more effectively. Turner-Little joins NAWB from Goodwill Industries International, where he mostly served as Vice President, Strategy and Network Experience. Over the course of his nearly 25-year career with Goodwill, at both the local and association levels, He served in a variety of roles, including Senior Director of Transformation and before that, Senior Director of Change Management and Innovation. I will now turn it over to our colleague, Jen Smith.
Career counseling, job search assistance, and occupational training. At the Department of Labor, we administer Titles 1 and 3. The adult program is for low-income adults. The dislocated worker program is for laid-off workers, and the youth program is for low-income youth and young adults with a barrier to employment. Both the WIOA Title I state programs and Title III, as administered by the Department of Labor, are subawarded to local workforce development areas. Services are delivered in almost 2,400 American Job Centers, or AJCs, across the country. Programs like vocational rehab and adult education are also available at an AJC, whether that is in person or virtual. The WIOA Title I state programs can provide many of the services that evidence shows are effective, like career guidance and supportive services that allow participants to be able to complete training. It can also be used to fund training directly, which is most effective when it's designed to respond to a specific industry sector's needs and when that training includes a work-based learning component. That evidence is also what makes the Department of Labor so passionate about expanding registered apprenticeship that addresses all of the effective aspects mentioned, and trying to find ways to help local workforce professionals in the WIOA system be better equipped to help their customers move into apprenticeships. WIOA gives states a lot of power to set policy. Some of the policy levers states have to shape how WIOA Title I plays out in their state are a unified or combined state plan, which outlines a 4-year strategy for state's workforce development system. Each U.S. state and territory submits this plan to the U.S. Department of Labor and Education. The Unified State Plan covers the 6 core Workforce Innovation and Opportunity Act programs, which are the Adult Program, Dislocated Worker Program, Youth Program, Wagner-Pizer Employment Services, Adult Education, and Vocational Rehabilitation. The combined state plan includes these 6 plus additional partner programs. This year, actually, 2024, is a WIOA state plan year, which happens every 4 years, as I mentioned. So additionally, joint guidance from the Departments of Labor and Education went out in October, requesting that states, among other things, target their workforce preparation efforts at good jobs, not just any jobs, and that they try to stay vigilant on identifying where there may be inequities in which parts of the state and which communities are seeing economic growth, and then use policies and service design to address those inequities. So those are some of the things that we'll be looking for in those state plans. States can establish one-stop certification policies as well for how people will experience services in AJCs. Governors can reserve 15% of the state allotments for statewide activities. And these funds are very flexible and can be used for almost any purpose under WIOA. Additionally, states are often in a better position than locals to do some of the data analysis on who's getting a program, access to a program, who's getting what services, and what employment outcomes they're getting. And this can also be disaggregated by race, ethnicity, gender, disability, additional other metrics that may be of interest. Next slide, please. In terms of the flow of the public workforce system, the governor appoints the state workforce development board membership. The chief local elected officials appoint the local workforce development board membership. Boards are business-led, and a majority of each board's members must come from the business community. Required members also include representatives from the 6 core WIOA programs that I mentioned, organized labor organizations, apprenticeship, and state and local government. Governors and or chief local elected officials may also select other groups, such as community colleges and community-based organizations to sit on the boards. Boards may also appoint standing subcommittees to advise and help manage the work of the board. Workforce development boards really drive the vision for the workforce system at the state and local levels and engage funders, partners, employers, and community members around that vision. The state workforce development boards advise and assist the governor in establishing policies and procedures that operationalize this vision and strengthen partnership and collaboration among and across local areas. Workforce boards play a critical role in promoting, sustaining, and growing regional economies. They're responsible for aligning investments in job training, integrating service delivery across programs, and ensuring that workforce investments are job-driven and match employers with skilled workers. Next slide, please. I know you're going to get a lot more color and flavor for some of the things I'm talking about from my colleagues at NAWB and NASWA. So just to touch lightly on a little bit of this, what are some things that might be helpful for you all in thinking about as you think about how you want to connect with workforce boards and American Job Centers? First, meetings of workforce boards are public and should be findable on their websites. So that's one way to connect. You can go to meetings to learn who board members are, the topics being discussed, subcommittees that may be of interest, and just generally to network with key partners. Additionally, WIOA emphasizes sector partnerships and career pathways workforce development strategies by requiring that local workforce development boards lead efforts to develop career pathway strategies and to implement industry and sector partnerships with employers. So identifying where local areas may have a sector partnership focused on direct care can be a key entry point as well. I mentioned previously the state plans that are developed every 4 years, and reading your state's plan can help identify areas of priority and potential connection as well. Additionally, AJCs are the most direct local connection for workers and employers. And on the employer side, AJCs assist with referral of job seekers to available job openings. They can provide assistance in development of job order requirements, match job seeker experience with job requirements and skills, assist employers with special recruitment needs, help arrange job fairs, assist employers to analyze hard-to-fill job orders, assist with job restructuring, and even help employers deal with layoffs. Next slide, please. I wanted to just really briefly touch on this piece. This is what we're calling our ETA vision for 2030. And this is really an opportunity for the public workforce system to come together to ensure that we're building an economy that works for all. And it's a cornerstone of our efforts under this administration to ensure our federal investments improve life for individuals and communities across America, particularly those that are marginalized and most in need. This vision has been guiding our work in ETA during this administration, and the first 3 pillars of the vision align with our priority for the 4th pillar and the efforts that are necessary to support the workers and employers in this sector. I really think it's important. I just wanted to point this out on this slide that the only sector-specific mention in all of these pillars is the care economy, which I think says a lot about how critical we view this sector to be. Next slide, please. One of the things I want to really touch on is our emphasis on good jobs right now. This, I think, is really integral to some ways in which things that we're doing that can benefit the direct care workforce in particular. So in addition to naming good jobs as a priority in the WIOA state plans, the department has used its platform to articulate what a good job looks like with these 8 good jobs principles, which we developed in collaboration with the Department of Commerce. These are things like having family-sustaining wages, benefits that provide economic stability, like health insurance and family leave, ensuring that all workers have equal opportunity, that workers have voice and representation in their workplaces, and that workers have opportunities for advancement. We in ETA issued guidance last year on the role of the workforce system in promoting good jobs, and we also held a job quality academy for 16 communities across the country that each focused on one specific sector of their choosing. These teams were made up of workforce development, worker voice, employers, and community partners, and they came up with concrete plans to advance job quality in their specific sectors. One result of this academy is a job quality starter guide, which is available on our workforce GPS platform. And if helpful, happy to provide that resource to everyone on this webinar. And that job quality starter guide identifies key levers that partners can use to influence job quality within their communities. Ensuring the quality of good jobs is much more than a labor issue, though. It's good jobs principles are directly tied to 3 of the 5 social determinants of health. In terms of economic stability, people with steady employment are less likely to live in poverty and more likely to be healthy. But many people have trouble finding and keeping a job, and in particular, a good job. In terms of education access and quality, low-income children, children with disabilities, and children with low quality across the other social determinant domains are less likely to graduate from high school or go to college. And this means they're less likely to get safe, high-paying jobs and more likely to have chronic health problems. Additionally, in the US, access to health care benefits is tied to employment. And where it isn't, it is usually because the poor quality of the job doesn't offer such benefits and also doesn't pay well enough to allow an individual to afford to buy health insurance on the open market or pay for routine health care out of pocket. Where these basic needs are not met, it creates a vicious cycle that can't be interrupted by poor quality employment that is paycheck to paycheck, maybe unsafe, and that feels tenuous. And that's why the good jobs principles and naming the supporting role that workforce development can play in advancing job quality has opened up a lot of new conversations about how to adjust policies and practices to ensure that workforce development helps customers land in good jobs. And we really think this is critical within the direct care workforce. Next slide, please. Speaking of critical, I was asked to provide some context for some of the common language that the department has been using recently. One key term is good jobs or job quality, which I just discussed. Another term that we've been using recently is critical sectors. Critical sectors can mean a few different things depending on the context. First, these are sectors that are critical to our nation's health and vitality and that support marginalized populations. The care economy is one of the key critical sectors here, as well as hospitality and retail. These are sectors where there aren't enough workers to fill the needs, but also starting occupations, that can be an on-ramp to work. However, there's generally poor job quality in these sectors, and they also tend to be disproportionately filled by marginalized and underserved populations. In another sense, critical sectors are also those that are integral to continued economic growth and global competitiveness for the US. And these include many jobs that are highly skilled and involve rapidly evolving technologies, such as semiconductors, that are the focus of the recent CHIPS and Science Act investments, as well as advanced manufacturing that supports, for instance, transition away from fossil fuels and toward clean energy, things like electric vehicles. So those are terms that we're talking about a lot in terms of our overall workforce development strategies. Just to highlight some relevant funding opportunities that we've put out recently or that are still available that tie into all these things that I just mentioned and maybe a particular interest to the direct care workforce. So I just wanted to highlight a few of these. Apologies. Next slide, please. Thank you. So the first one I really want to point out is our critical sectors grants, technically critical sectors job quality grants, of course. And these are grants that we have 2 rounds. Well, second round is coming soon, but we've already awarded the first round. And these very specifically focused on the care economy, hospitality, and climate resiliency, which is not to be confused with clean energy related climate efforts, which is about, what we can do in the future, but really is about dealing with today with the cleanup from climate disasters and mitigation efforts that support the ability to withstand climate disasters, things like building earthquake resistant buildings. But these are some key critical sectors that are challenging and in many ways don't offer high job quality. Unfortunately, in round 1, though, we only got 1 grant that actually focused on the care economy, and their focus was really on early childhood development rather than direct care services. But in round 2, we are reiterating our commitment to support job quality enhancement within the care economy. So we have called out in the second round of funding, which I should say closes on Monday, the 15th, but is still open. We've called out in that round a commitment to award up to 50% of the available funds for care economy focused projects, because that is really an area that we think is so important to support with job quality. Another one I'll mention briefly is the Senior Community Service Employment Program put out a unique optional demonstration funding opportunity, which just closed last month, and included a specific call out for projects to focus on training low-income senior citizens for care-related occupations. Additionally, my office awarded last year nursing expansion grants that have a strong focus on ensuring career pathways progression for participants, and specifically encourages targeting participants who may have existing occupational experience and certification as things like home health aides and CNAs, which again are disproportionately minorities, and providing training to assist them to become LPNs and RNs. Going back to the social determinants of health, there is strong evidence that health outcomes for minorities are improved when they have access to medical professionals such as nurses and doctors that look like them. Finally, I'll just mention Apprenticeship Building America. It's already had one round of funds awarded, and the second round of grants will be awarded very soon. So this is another one that closed, but we continue to have constant opportunities for funding in the Office of Apprenticeship. So I imagine there will be more like this. But I did want to point out this one specifically because this funding opportunity did also prioritize in-demand sectors and occupations that include the care economy, specifically nursing, early care, mental health, direct care. And the Office of Apprenticeship is continuing to provide funding to build a robust national ecosystem of registered apprenticeships that translate training into good jobs and can work in diverse sectors. Registered apprenticeship programs are excellent examples of good jobs as they have built-in family sustaining wage requirements and wage and skills progression. Additionally, Apprenticeship Building America, like previous apprenticeship grants, has a focus on building diversity, equity, inclusion, and accessibility into the modern apprenticeship system through targeted outreach to marginalized populations and communities. And there are many examples emerging of direct care related registered apprenticeship programs. And we are continuing to emphasize that and hope to see a lot more with the second round of funding when it's awarded. I'll stop there because I think I'm right at my time, and I know we have some more specific questions that we'll get to in a little bit. So I will turn it back over to Laura. Thank you.
Great, and we will now hear from Brad.
Greetings all. Thank you for the invitation to be a part of today's webinar. I am Brad Turner-Little, the President and CEO of the National Association of Workforce Boards. Jennifer provided you all a wonderful overview of our nation's federal workforce system, how it works, how the Department of Labor at the federal level engages with state workforce boards, and then how local workforce boards are part of that system as well. Our organization represents the nearly 600 state and local workforce boards across the United States and including all the territories. We provide services, supports, and representation for all those boards in ways that we hope can really foster economic vitality in communities all across our country. Building a little bit and provided in terms of her overview, thought it would be helpful to reiterate just a few items, and then I'll invite my colleague Ben from NASWA to come on. Number one is that local workforce boards are a key component for you all to consider engaging to identify and support sort of supply chain of talent to become direct care workers. Local workforce boards really are the backbone infrastructure in communities all across the country that bring together business, talent, and training to figure out how can we build bridges to support business growth and talent development, making sure that individuals have the competencies that are needed in a given community to actively participate in a local economy. So local workforce boards convene the business community. Jen talked about emphasis on industry sectors. Certainly the care industry, healthcare. I know there was a question that popped up about how you define the care industry. But healthcare, oftentimes in many communities, is a focus area for local workforce boards that then will support the building of what we call sector partnerships, which is where businesses identify sort of career paths within their operations, and local workforce boards can work together with training providers such as community colleges or other private training entities to build a trajectory for individuals that is based on the acquisition of or attaining of stackable credentials over time so that they can build a career path moving from direct care workforce into management up into executive, however that may need to play out for those individuals. So there's a lot of opportunity for you all to engage with your local workforce board. And we're going to talk a little bit about it when we get into the question period. But I would highly encourage you to, you can identify who to connect with at your local workforce board area through careeronestop.gov, I believe, Jen, if I'm not mistaken. You can correct me when we come back online. Where you can find information about the workforce board in your area and who to contact. in addition to Jen mentioned that all their meetings are public, oftentimes chief local elected officials are looking for individuals in the business community who are interested in serving on local workforce boards, and on state workforce boards, for governors as well. So there's opportunity for you to get really involved with your local workforce board and building the strategies to bring business talent and training together in really powerful ways. We've got a lot that we're going to get into around leadership. I saw a question pop up about how you define work-based learning, and how does that sort of fit into this space, and we're going to explore that in just a little bit. But I'm going to stop because we want to make sure we have good time for y'all's questions that were received prior to today's session. So Ben, I'm going to turn it over to you.
Hey, thanks, Brad, and thanks, Laura. Good afternoon, everyone. Just to reintroduce myself, my name is Ben Mays, and I'm a policy director here at the National Association of State Workforce Agencies, also known as NASWA, NASWA, where I work on a range of workforce development issues. Just to briefly describe myself, my pronouns are he, him, his. I'm a white male in my 30s with brown hair and blue eyes. And today I happen to be wearing a white shirt with remarkably stylish glasses. So I just want to begin by really thanking the Direct Care Workforce Strategy Center for the opportunity to participate in today's session. And I also want to thank everyone who's participating in this call for the critical work they're doing to support direct care professionals across the country. Next slide, please. So just as a bit of background on our organization, NASWA was founded in 1937 during the depths of the Great Depression, during the rollout of several New Deal programs focused on returning people back to work and creating meaningful employment opportunities. And throughout our history at NASWA, we've really served as a convener of state workforce agencies on issues as varied as unemployment insurance to employment and training services for our nation's veterans. And I think this was mentioned in the introduction, but just to underscore, we represent all state workforce agencies in the 50 states, DC, and the US territories as well. On the topic of us serving as a convener of state workforce agencies, I thought this slide would be helpful. This is a photo from our 2023 summit in Los Angeles in September of last year, and really kind of underscores the convening role that we play on workforce issues with our members. Next slide, please. So I don't know if you can see the text here, so apologies for that. But at the core of our organization, a group of national policy committees, which meet both in person and virtually multiple times a year. And if you look at the committees that are represented on this slide, this should give you a pretty good sense of the programs that state workforce agencies typically oversee. Just to highlight a few of those major programs and their corresponding committees here, you have the Unemployment Insurance Committee, the Wage and Hour Committee, which brings together state officials who enforce wage and hour laws. You also have Workforce and Labor Market Information, that committee at NASWA, which is for the directors of state labor market information shops, which is something I hope we'll have the opportunity to speak about a little bit more later on in this discussion. And then at the bottom right of the screen, you'll see NASWA's Employment and Training Committee, which convenes state workforce development directors. And I really want to focus a lot of time on that committee right here, because these are the individuals who at the state level are responsible for overseeing the core WIOA programs. I know that Jen provided a really good example of those programs and an overview of those programs previously on this call. So I'm not going to delve into that now, but just to give you a sense of some of the other workforce programs that state workforce agencies oversee. We have JVSG program, the Jobs for Veteran State Grants program, which provides federal funding for states to hire dedicated staff to provide individualized career training services to veterans. You also have many states that oversee registered apprenticeship programs in their state as state apprenticeship agencies. And then in some instances, you also have state workforce agencies delivering employment and training services to SNAP and TANF customers. And then on top of all these federal funding streams, increasingly you're seeing a number of states that are offering state-funded workforce development programs. And some of these can be pretty substantial. Just to give you a sense of one of those, California, as one example, is investing $65 million in expanding youth apprenticeship in their space. So I see we're on the next slide, but just to give you a sense of some of the priorities and current areas of focus for state workforce agencies, I'm not going to run through all of these, but I thought it would be helpful for folks on this call to get a better understanding of what our members are really focusing on now in the present. So I think this was alluded to previously on the call, but following the passage of the Bipartisan Infrastructure Law, the CHIPS and Science Act, and the Inflation Reduction Act, a lot of states are working on workforce development programs in the sectors of the economy that are seeing those investments. A huge amount of focus right now on broadening registered apprenticeship programs and other work-based learning opportunities. You have a huge focus on sector strategies initiatives, reentry initiatives for justice-involved individuals, and veterans initiatives as well. In certain states, there's a significant focus on delivering workforce services to asylum seekers, refugees, and immigrants. Of course, there's a significant emphasis on assisting people with disabilities. And then shifting more on the operational side, a number of states, particularly as we're emerging from the COVID-19 pandemic, where so many services shifted to virtual, are exploring with innovative models of service delivery. So you have virtual service delivery, the use of mobile units that can move across state in different areas of the state, as well as innovative partnerships and partnership development with organizations like libraries. You have a lot of states focusing on how can we broaden supportive services to support individuals with barriers to employment. You're having a lot of states looking at how can we leverage artificial intelligence in our state workforce agency operations. Staffing, recruitment, and retention is a major challenge facing many of our members, and I'm sure that probably resonates with a number of folks on this call today. And then, of course, you have strengthening partnerships across core WIOA programs, but with other systems as well, such as human services. Next slide, please. Just wanted to highlight one resource we have at NASA, which is our State of the Workforce Report. We last produced this in 2023, and you can access that on the link here or via the QR code on the bottom left. And something I just wanted to highlight is we do have state-specific profiles that are 2 pages each, and they include relevant information on the state workforce agency or agencies in each of your state, where workforce programs specifically are housed, things like key labor market trends in each state, as well as what major priorities exist for certain states as well. Next slide, please. And then the last thing I'll just mention is NASWA, like NOB and other organizations, we're involved a lot in policy engagement in the workforce space. We have our 2024 legislative priorities, and there should be a link that can be accessed in the PowerPoint that will be circulated. Just to highlight a few of our workforce development pillars, we're really focused on increasing federal investments in the workforce system, increasing flexibility for states, aligning the workforce system with other systems like human services, and of course, promoting economic mobility. We've also been engaging a lot around WIOA reauthorization, and we've issued a document with guiding principles on that as Congress moves forward with their discussions around WIOA reauthorization. I hope we'll have some time to talk about that towards the end of the call. And then lastly, NASWA is also engaged in a number of regulatory issues, such as the U.S. Department of Labor's proposed changes to the national apprenticeship system, and also the new WIOA-based performance measures for the TANF system. So that should give you a good sense of our organization, our members, and maybe point you to some helpful resources as you think about how you can engage and partner with your workforce partners at the state level. So thank you so much.
Now we'll pass it off to our director, Stephanie Gibbs, to begin a moderated Q&A.
Great. Thank you, Laura. And thank you again to each of our speakers for sharing those informative presentations and remarks. As we transition into the moderated session, I will remind the audience to please submit any questions into the Q&A. While we may not have the time and opportunity to address all of the questions, we will certainly review them to inform future webinar offerings, and hopefully we can get the band back together here and have another conversation in the future. So again, I'm Stephanie Gibbs, Director of the Direct Care Workforce Strategy Center. I'll offer a visual description for my online presence here. I'm a woman with long brown hair. I'm wearing glasses that aren't nearly as stylish as Ben's, but they will work. And also I have on a yellow shirt and a white blazer. So just to share a few sentences about the Direct Care Workforce Strategy Center, we at the National Council on Aging administer the Strategy Center on behalf of the Administration for Community Living. We focus on supporting state system transformation efforts to in turn support the direct care workforce. So we thank our funders at ACL for their commitment to this work. And we also invite the audience to please feel free to visit the website, which I think can be dropped into the chat for more information. So now I'm going to turn to the panel. So the focus on today's webinar is really about engaging the state workforce systems, understanding common terms and practices to foster partnership opportunities to support the direct care workforce. And we know that system transformation efforts really depend on strong relationships across disciplines. And so I'm curious here if we could learn more about what are some of the ways we've seen state Medicaid, for example, or other stakeholders in the healthcare and aging and disability spaces successfully come together in partnership with labor and workforce to support the direct care workforce, such as through apprenticeship opportunities, for example. So I will come to Brad first for his remarks.
My apologies, I was muted. And I failed to say I'm a mid-50s white male with short brown hair with a striped shirt that looks relatively blurry on the video. So my apologies for making this my attire choice for today. A couple things on the models and engagements that we see out in the field with agencies and others. Number one, there are, I think, really interesting sort of intersections between sort of the workforce system and those involved with direct care and the broader healthcare conversation. I think we've mentioned the term, the intersection, Jen, you might have around the social determinants of health and the way and the role that a workforce board plays in a state or in a community to encourage individuals and find pathways into work. And as such, you'll see in a number of communities, there are dedicated training opportunities and career pathway strategies for folks to go into direct care as part of healthcare strategies, sector strategies, those types of things. You'll find the Medicaid provider or insurer in a given state oftentimes will be connected to or involved with a state board, and that will translate into having a seat on oftentimes a local workforce board to really be involved in the strategy development around how might resources be best deployed in a given community to create opportunities for those that may be facing challenges into high demand occupation areas. And so you see those in a variety of different sort of places and ways. And I do know that there are a number of local workforce boards really have doubled down on the career pathway strategies in the healthcare space. And oftentimes the on-ramp can be direct care, part of the direct care workforce. So there are paths there. I know we've had a couple of different comments that have popped up in the chat around apprenticeship and the role that it can play. So, and I think oftentimes it's what seems to be popular with the chat are some of the barriers that folks are experiencing as it relates to the ability to stand them up. And I think that that really speaks to the need for advocacy work. Ben mentioned the activity that's happening right now with the congressional efforts to reauthorize the Workforce Innovation and Opportunity Act. Having those sorts of experiences where there's a willing and interested employer or sector to get involved in apprenticeship programs, when you bump into those barriers, it's really significant and important to provide that feedback to state departments of labor, to the U.S. Department of Labor, and arguably even to members of Congress, as there are efforts to reauthorize the National Apprenticeship Act. as well ongoing. So those sorts of things oftentimes are policy decisions that can be changed because the way work happens and the way training happens is different now. Oftentimes you'll see, I'll sort of offer this, and then Ben, I'm going to invite you in. When you talk about apprenticeships and you see them growing in spaces like the financial industry or the insurance industry or in education, other systems like that, some of the ways that apprenticeship structures are built that were absolutely relevant in a trades environment, let's say, particularly as it relates to safety, don't translate. And those can create barriers which can be remediated through policy change, and can create pathways for people to be able to earn and learn, build the careers that they want, and businesses get the talent and competency sets that they need. Ben, do you have some thoughts on sort of specific models that you've seen?
Yeah, absolutely. So Stephanie, in response to your question, I actually have a little bit of an alternative response because it's something that exists outside of the care economy. But I think a really promising example of success on the workforce front in recent years has been the recent expansion of registered apprenticeship programs for teachers. For those of you who are less familiar with this, a couple of years ago, there were 0 states with registered apprenticeship programs for teachers. And now I believe the number is over 35 states. So in a pretty short period of time, you've had just a rapid expansion of training programs for teachers, particularly in the apprenticeship space. And I think there are some important ingredients of success that can provide some best practices for folks on this call as they're thinking about engaging the workforce system for the direct care economy. The first is there was a real articulation of meeting a significant labor market need, given the critical shortage of teachers in the wake of the COVID-19 pandemic. On top of that, there is a real direct connection and value add for employers to ensure that these programs are truly demand-driven. And in this case, employers were largely local school districts. There also, of course, was the proven earn and learn model, demonstrating real value for job seekers. And then just on the process side, I think what you saw that was really promising at the state level was significant cross-agency collaboration, coordination, and alignment between state workforce agencies, state departments of education, and in some instances, state departments of higher education. So you could see regular meetings, real coordinating roles, and then alignment of policies, resources, and roles across agencies. So I think it's a really great case study that can inform all the great work that is going on in the care economy and will go on in the care economy.
Great. Thank you so much for that, Ben. So it certainly sounds like there are some effective practices and other industries that might support our goals here with respect to the direct care workforce. And I'll just make a note here, Jen, in a future conversation or a future question that we'll get to, if there's an opportunity to provide any color around a DSP, registered apprenticeship program, I would certainly invite you to do that as well, just to kind of round out the conversation as well here. So moving to the next question, as we think about partnership opportunities, we certainly think about communities of potential recruits that we would want to engage as well. And so we'll turn to the panel regarding what labor-related policy or programmatic initiatives are available to promote and recruit workers into the direct care workforce. So especially to reach and recruit diverse communities, including, for example, older adults, people with disabilities, the immigrant community, rural communities, and perhaps justice-involved populations as well. So Jen, we'll come to you first for that question.
Hey, thank you. Yeah, I mean, this happens in so many various ways. So try and synthesize this a little bit. I mean, older adults was referenced, and I did mention the funding opportunity announcement through the CSEP grants that is focusing on older adults and is focusing on trying to get them the direct care economy. So we have, using that as one example, we have a lot of specific, particularly our competitive grant programs that target certain populations or certain communities. We have some grants that focus on very specific communities. So that's sort of built into the structure of some of the grant opportunities. One thing I'll say broadly is just last September, the department published a training and employment guidance letter, which is our sort of policy notifications to the workforce system, to highlight diverse ways in which outreach can occur, and really was about attempting to dispel some of the myths that are out there about how WIOA funding can be used for marketing, for instance. And the goal of the training employment guidance letter was to try and emphasize ways to equitably conduct outreach, to reach some of these, diverse populations, and to not just focus on the low-hanging fruit, if you will, of easier to reach populations. I kind of mentioned this, but really in all of our recent funding opportunities, there's an emphasis on targeting marginalized and underserved populations, either as specific, because of specific demographic characteristics or because of where they reside, such as rural areas, tribal areas. And we've also really been trying to emphasize in the last year the inclusion or priority for grant awards that go to tribal organizations or historically Black colleges and universities or other entities that specifically serve some of the marginalized communities we're really trying to reach. So that's one way in which we do it, or have done it traditionally. The other thing that I'll just mention briefly is that there have been several executive orders in this administration that are really focused on improving the equity within our actual grant awards and who gets our grants. And that really influences who's served by those grants, right? Is dependent on the target service area and the culture and the community of the actual organizations themselves. So that's one way that we've been trying to address it recently that we hadn't previously. So really thinking about, those with lived experience, and who have an understanding of marginalized populations and communities. So trying to reach organizations that are in smaller or more rural communities and that may have limited organizational capacity, which means that they have not historically been competitive with our grant awards, which are admittedly very complicated, our funding announcements. They may require things like match that are not as available to smaller entities, or they have complicated administrative and fiscal restrictions that are placed on grantees once it's awarded. So to address these challenges, we've been undertaking some important work recently to really revise our policies and practices in grant making. We've done that first through launching an advancing equity and grant making initiative where we had online forums to hear from entities that have gotten our grants previously and really learn from them what are the challenges and barriers that have really limited the diversity of our grant recipients, as well as some of the burdens of managing and reporting on those grants. And then that feedback has been really helpful in now informing the next aspect of this, which is that we have an Office of Management and Budget mandate that has formally begun to simplify our funding opportunities to support grant engagement with underserved communities. So the mandate is very specifically prioritizing simplifying funding opportunities also for programs that are for job training. That's sort of like the first call out is to focus on those funding opportunities, particularly those that focus on training in underserved communities. So that's something that we're actively working on right now. And it's gonna take a few years to fine tune that process, but there's a lot of really helpful engagement across different agencies, providing examples of how they've done that. And we're really trying to work on that. We're committed to starting to try and make our funding opportunities just easier to access. And we really think that will have an impact in terms of who gets the grants and therefore who they're serving and what communities they're in. And it's the first time we've really undertaken something this transformational around our grant making processes.
Great. Thank you, Jen. That's really helpful. Let me come to Brad and then to Ben.
Yeah, I'll just throw in here real quick. Jen did a really wonderful job sort of talking through the grant strategies as a part of at the federal level. Coupled with that, she mentioned that last year there was guidance that came from the department around that really clarifying for local workforce boards that they can use resources in a way to do outreach in the community to really engage with oftentimes populations that are on the fringe within a given community, the individuals who maybe disconnected because of lack of broadband access, or may have challenges related to transportation, and struggle to be able to get places. Now you see a lot of local workforce boards that have created mobile strategies where they take the American Job Center to communities through mobile vans and other kinds of strategies to create access points for populations, just as Jen was describing, that oftentimes have not been able to access in an equitable way opportunity through the workforce system. So, and I will also say, and Ben, I'm going to come to you in just a moment, because I think this is an important point as it relates to the data that the state departments of labor really have access to and can help inform strategy development. But in the authorizing legislation, which has been talked about a couple of places, there is a priority around services for individuals, Stephanie, that you just articulated, that come from certain segments within our population. So the local workforce board, the state workforce board, in your communities or in your states are thinking about how to create pathways for those that may not have had an opportunity to find their way into today's economy, particularly, in general. And then I think the folks who are on today's webinar can really influence those planning processes and those strategy development activities to really drive the need within the direct care workforce structures. So I'm going to stop with that. Ben, I want to turn it to you just real quick, if you don't mind.
Yeah, I mean, I think Jen and Brad covered a lot of ground. The only two items I'd layer on top of that would be, I think Jen mentioned at the top of the presentation, the governor's reserve, which allows states to reserve 15% of WIOA Title I funds for statewide needs. And, there's a lot of flexibility in the use of those funds. And so it may be worth engaging your state workforce agency and just kind of exploring if there's any possibility to leverage those funds for the care economy. And then the last thing I'd say is potentially engage in discussion if there are any state-funded workforce development initiatives. Those often have a lot of flexibility as well. So just wanted to highlight those two items.
Really helpful. Thanks, everyone. So I'm noticing that we're getting close to the end of our time together, and we still have a couple of things here that we want to address. So Jen, let me come to you first to tell us more about sector strategies, which can help businesses from a region's high demand sectors recruit and retain skilled workers. So can you help us highlight the key aspects of the sector strategy framework, and also how sector strategies can specifically support the direct care workforce? I'll come to you first, and then I will have a follow-up question for Ben and for Brad.
Sure. Yeah, happy to do that. So sector partnerships, the use of sector strategies is an evidence-based practice for effective workforce development. It's really the best way to meet the needs of both employers and workers, and to bridge the gaps between them, helping employers to create good jobs that will make them competitive for hiring the workers they need. The Department of Labor actually created a sector strategies framework back in 2016, but now 8 years later, it feels very outdated. So we've actually been working to update the framework for what we know works now and what we know is necessary for an effective good job sector strategy. So we did some background work with a request for information to the public to learn, what were some of the challenges and most important and critical aspects for them. And some things were really lifted up that have helped us to think about this more in a more diverse way. And in particular, a lot of that has to do with the influence of worker voice and making sure that workers are at the table where the sector strategy is being developed to address some of those challenges that lead to a job not being a good job. And there's a lot of evidence that shows that that's really impactful in terms of creating a quality sector strategy. Another aspect that has evolved in recent years is a greater emphasis on skills first. So helping employers to identify what the critical skills are that workers need instead of just focusing on, for instance, a credential. This is where work-based learning and on-the-job training can really matter as well. I also want to point out that sort of tied to this and tied to what may be helpful for this audience is that the Department of Labor collaborates with industry partners and associations to develop competency models that help identify the core skill needs as well as competencies that need to be developed as workers move along a career pathway. And we do have a competency model for the long-term care supports and services industry, as we call it. And that was created to support workforce development efforts to prepare workers who care for the aging population and also make it possible for those with disabilities to work and live in their communities. And we really think competency models are a key strategic tool for sector strategy and engagement with employers. It can help to just support the training design and to identify which skills are foundational and which skills can be developed through experience in the job or additional training. So those are some things that we really focused on refining in the new sector strategies framework. And we'll be publishing the new framework later this summer. And we'll also be providing technical assistance on how to use the framework later on this summer, along with relevant examples and best practices of sector partnerships that are impactful. In terms of, how this can help the direct care workforce specifically, to create more job quality and diversify the entry and career pathways for direct care workers, a sector strategy that incorporates direct care worker voice is critical. But sector partnerships also include all the relevant partners within the local area that are impacted by or can influence and shape that sector. So that means not just the workforce boards and the employers, but also industry associations and also education and training providers, such as community colleges. As one example, through a sector partnership, direct care workforce partners can work with community colleges to potentially develop a continuing education curriculum certificate that could be a springboard for going on to earn an associate's or a bachelor's degree, for instance. Or they could support the design of specializations within direct care, perhaps, that require additional skills and training, such as working with Alzheimer's patients that can come with higher certification and pay. So I know that I saw a lot of stuff in the questions in the chat, the Q&A section, about the challenges with Medicare and the challenges with pay. And I fully understand those. We know how challenging that is. And not necessarily something we can address on our own. But I'll also say that in some of the good jobs work, what we found is that pay is not always the first one, believe it or not. It's important, but there are lots of other things, such as career progression and getting those skills and having quality benefits or regular hours. So I understand that pay is a key one, and that's one that's really hurting the industry in a lot of ways. But if that one can't be addressed, maybe looking at some of these others can help to lift it up in general. And I know I spent a long time. I apologize. I will turn it over for the follow-up question.
Great. Thank you so much, Jen. That's very helpful. And thank you for that grounding around sector strategies. Let me ask our panel, are you comfortable going a few minutes over here? No pressure if we need to have a hard stop at 4, but I know there were some things that we were hoping to cover.
I have a few minutes, but I don't have all that much time, but I can give you a few more.
I appreciate that. Okay, thank you so much. Okay, so I know there was a particular interest in exploring braided funding opportunities from some of our audience members. So we'll come to you, Brad, and then to you, Ben, around what are some recommended practices or examples of cross-system, cross-agency strategies that support workforce efforts at the state and local levels. Which would include braided funding opportunities. And then also, how do we see private and nonprofit sectors play a role in building up the direct care workforce?
Yeah, so I'll jump in on this one to begin with, and then turn to colleagues on the panel. For the braiding of funds is one of those areas that, quite candidly, local workforce boards have been thinking a lot about, probably over the last 25, 30 years. Because on an annual basis, they are funded through primarily the appropriations process in Congress. And it is a discretionary program, unlike some of the other, if you're Medicaid or Medicare connected to those systems on today's call, those are mandatory spending programs. And in the WIOA world, we have seen resources be cut dramatically over the last 25, 30 years to support the local workforce system. Matter of fact, even this week, the House Appropriations Committee, coming out of committee, their appropriations spend on the WIOA programs was cut another, I don't know, 30%, I think is what the number was. So local workforce boards, to really be able to do the work, have spent a lot of time thinking about how do we create mechanisms to leverage other funds like SNAP, E&T, and connect more distinctly and appropriate, in appropriate ways with. There are even workforce boards that are employment networks and the ticket to work world and the Social Security Administration, to be able to leverage funds in those ways and braid them together. Most significant, and I think probably in this conversation, is that about 60% of the local workforce boards across the country now have spun off and are operating as nonprofit organizations, which allows them then to pursue philanthropic investment, corporate foundation investment, and bring additional resources to bear to be able to try to respond to local workforce needs, whether that be sort of the challenges that businesses face to find talent, or talents struggle to find access to training. They're able to leverage that sort of, quite candidly, their incorporation status to create access and create an ability to braid more types of funds beyond just government funding programs. But I'll stop there. I know we want to get a couple of sort of responses on this one. Ben, I'll turn it to you.
Thanks, Brad. Yeah, I mean, I think there are a lot of great state examples out there. One initiative I'd highlight, Healthcare for Me in Maine. I don't know if there's anyone on this call from Maine, but really a great collaborative effort between Maine's higher education system, Maine's Office of Adult Education, the Department of Health and Human Services, the Department of Education, and also the Department of Labor. But they've been leveraging funds to support training in a number of different healthcare occupations, as well as the care economy, such as certified nursing assistants. So I think that's a really terrific example. And then the last thing I just want to mention, I know this isn't a direct response to your question, Stephanie, but I really want to emphasize it before the end of the call. But state workforce agencies have labor market information shops, and they can be really meaningful partners to individuals working on training programs for the care economy to get a better understanding of what trends are going on within certain industries, certain occupations. So they can be really meaningful partners. They have a bunch of expertise that they can bring to the table. So just wanted to make a plug for that.
Thank you for that. And just in the interest of time, we'll ask our panel if there's anything else that you'd like to share today around initiatives that are on the horizon, emerging themes that may be helpful for our audience. I'll turn to each of you if there's just anything more that you'd like to share. Jen, this may be a chance for you to talk a little bit more about any additional apprenticeships opportunities that are out there, or ODEP, which I know we had talked about in the pre-work as well, or the SEED program. So let me come to Ben first, and then Brad, and then Jen.
I know Brad and I would probably both mention WIOA reauthorization. We're laser focused on the recent movement in Congress on that front, and the potential change that may bring to the public workforce system. I'd also add the U.S. Department of Labor has proposed changes to the national apprenticeship system. And so it will be interesting to see how that all plays out and what the implications might be for apprenticeship programs in the care economy.
Great. Brad, anything from you?
Yeah, I'll echo what Ben said. The legislation that authorizes the workforce investment system, or the WIOA system, has been expired for the last 5 years. It expired in 2019 and has been operating under just through appropriations on an annual process. This is the first time that there have been bipartisan bills that have come we have a bipartisan bill that came out of the House and are very close to having a bipartisan bill to make it through Senate committee. And so the likelihood that something is going to happen to reauthorize the federal system is very strong and likely this year. So if you're not watching that movement, I would strongly encourage you to do so. I think both Ben at NASWA and me and our colleagues here at NAWB, we have some ideological policy disagreements, but in general, I think we're both in the space of, we really do want the bill to be reauthorized because of the importance that workforce boards play in communities to help build strategies to create the right kind of workforce ecosystem for all sectors, including those connected to direct healthcare. I will say, I did mention the appropriations process. It is significant and important, and I recognize that there are a lot of really significant and important systems that are funded through the federal appropriation process, congressional appropriation process. This is one, however, I think that has been shortchanged for a long time and is desperately in need of support. So I would encourage you to be supportive of increasing appropriations for the nation's workforce system. And lastly, I agree with Ben. I think that the Department of Labor, and I know that just isn't Jen's area, she's in another section within the Employment Training Administration, as opposed to the Office of Apprenticeship. But there wasn't a notice of proposal making that was the Department of Labor issued in the last several months, soliciting feedback on some proposed changes to the apprenticeship program, some of which I think could really help, and some of which I think create some real challenges for businesses to participate. And the department signaled that they'll be publishing final rule in the next month or so. So it will be interesting to see kind of what shakes out in that process and how that might inform or influence the healthcare or long-term care space and direct care workers specifically.
Thank you for that. Jen, coming to you to close us out.
Okay, can I do this shortly? Yeah, no, so I'll just say, yeah, I mean, WIOA, they're like, we're all focused on that as well, obviously, for variety of reasons. So I won't go into that. I will say I saw that Jennifer Sheehy is on here, who is the I think she's the deputy administrator for the Office of Disability Employment and Policy, deputy assistant secretary, rather, I apologize. So I'm probably not going to do justice to SEED, but I will just very briefly mention it for if anybody isn't aware of it. It's a wonderful state exchange on employment and disability. That's what SEED stands for. And it's the Office of Disability Employment Policy funds or contract that supports it. And it's a really unique state and federal collaboration that supports state and local governments to help them develop policies and implement inclusive policies and best practices that increase employment opportunities for disabled people. So I won't say more than that. And I'm sure she can provide info in the chat if she's still on the webinar. But it's, you know, an amazing and great and innovative process that has really moved the needle on competitive integrated employment, and is worth looking into if you're not familiar with it. It's just also a great example of how, you know, federal and state can work together that you don't always see so often. The only other very last thing I would plug that may be of interest to you all is that there is a federal register notice right now around what we call the standard occupational codes, or SOC. Those get revisited every about 10 years, and they're working on them now. And that often, I know it includes a public comment period, which is open right now in the Federal Register notice, if you look for it. And that may be an area where you can kind of, you know, try and lobby or advocate for how direct care professions are identified. So that's another thing that may be of interest, and I'll stop there. Thank you for the extra time.
Jen, thank you so much for that. A special thank you to all of our panelist speakers today for your extra time as well. And thank you to our audience for tuning in. And this concludes our webinar today.